Well, hello, Karen. How are you doing?
I'm good, thank you. How are you, Dr.
Excellent.
Crona?
I was looking back at my records, and you have been a patient of mine since 2008. So,
I thought it was even earlier, to tell you the truth.
might be because there might be some records in storage, but it's been a long time, at least 17 years, possibly longer.
That's funny because just before getting on, I was thinking back of when I first met you, and it was very interesting because I had no idea what you did.
Mhm.
And I was having one of those lovely, like my first baseline colonoscopy, and one of the recovery room nurses, I was talking about I needed a good primary care doctor. She said, I know just the person, and this guy saved my son's life. And I thought, well, that sounds good. And she said, well, he's really great bedside manner, very good communicator. And I said, sounds like the guy I need to see.
Well,
And so,
back then, I was, still I hadn't quite broken into doing this full time. Well, you know what? Maybe I had already at that point. I
you
started.
had a, sorry.
I've been primary care since 1992, and I kind of started moving into full-time mental health about probably about 2000 or one or two maybe, or right around the early 2000s, and so I that's where I kind of gave up on primary care, and I couldn't do it all anymore. I was too busy, and but I was still did a little bit here and there, but try not to.
That was right at that point, I'm sure, because it was in an office and there was other docs. But I remember talking to you, and I didn't expect like what you offered, but it was so mind-blowing in such a good way. I remember thinking to myself, this guy is either a complete quack or an amazing genius. And I think at the time I'd been prescribed like Cinequan, which is the early tricyclic antidepressant. And
Wow,
there was no
that's all.
doubt that I was dealing with some up and downs. And
Yeah,
and actually, in all honesty, I had just crossed through menopause and my fiance died. So if somebody would ask me, are you depressed? I didn't have a good response. I
right.
would be a little defensive and say, well, what do you think? So
Yeah,
so I wasn't aware of my moods so much as I felt I was in circumstances that were difficult.
right.
But increasingly sleepless, always had insomnia. And I remember, I think you started me out with like 25 milligrams of Seroquel, and you started the lamotrigine right away, the Lamictal. And I thought, wow, this is weird, you know. And and I remember that first night I took the low dose of Seroquel, and I think I contacted you or something. I said, "Oh my God, what is that?" Because I have never slept so well in my life, and it was so restorative. Um, and you explained to me that like the Cinequan, which helped me sleep a little bit, you said it was like a Band-Aid for what was really going on.
Mhm.
And I don't know if your listeners want to hear this. I could do a brief history of why I didn't think.
If you can, yeah, if you can, actually, I'd love you to go back to the beginning. When you,
Like when, yeah, okay.
where in your life would you go back when you first started realizing there was some kind of a problem? How old were you? What was going on?
I didn't really realize till as an adult reflecting back, so I can kind of pinpoint it that well, it was odd. Everybody has kind of family origin stuff, but I will say dysfunctional family. But my dad would be, we're going to go for an outing this weekend. Let's go for a hike. And he would take all of us and, hike all day to the top of Mount San Gorgonio. That was not fun. And, we learned kind of at a young age that, oh God, if you go with dad, he's going to stop by a few, whatever, see some friends, has a few errands here and there, but we learned to never go with them because it would be never ending. You'd be kind of stuck all day. And the home was chaotic. And then my mother was always like severely depressed and would be kind of rally the kids around her. Look at this terrible man. He's so mean, and I'm so depressed, and I'm a victim. And, they're both gone now, so I feel like I'm okay to say this. But but what happened for me was I remember at about age 7 being very clear with whatever my emotional needs were, they weren't going to be met in this family. So I was of the four of us, I was very exploratory with, friends, parents, and that, and kind of was trying to get a gauge, and at the same time, kind of spirituality, like go to different churches. My parents didn't really go to church. My mother ended up following kind of this Bhagwan Rajneesh person. So, it was pretty fragmented. But for me, I thought that the issue was addiction, alcoholism. Although hindsight, I don't recall my father drinking so much. And it wasn't until seeing you, um, but I had lived abroad at the time when, like after my fiance died, I was offered a job in England outside of London teaching. So I was flying back and forth and still not putting together what was really going on with me. And I'm going to back up for just a second with the siblings. Of all four siblings, I was probably the highest functioning as far as, working, independence, buying homes, kind of really being the responsible adult. So after seeing you, it was great because you didn't say, oh, by the way, you're bipolar. You know, I still, even today, it's like I'm real guarded with that because being a practitioner myself now, as far as mental health, it's one of the mental health illnesses that is completely recoverable with medication.
Right.
And so I love, we really need to destigmatize it. And as a matter of fact, I believe I was still seeing you, and I remember um, it might have been a urologist. It was some specialist doctor. And, thankfully, I don't remember her name. I probably wouldn't repeat it. But I'll never forget how awful it was because she kept, getting her face in my face, looking at the medications, which at that point was Seroquel and Lamictal. And to your point, how you were not acknowledged, she really got on me. What are you addicted to? You're lying to me. You're an addict. And it was so hostile and so uncomfortable that I thought, okay, what is the signaling here? But I remember talking to you, and you were very good about, well, yeah, the truth is, there's bipolar and there's kind of bipolar. So technically, but there's these other types, and you kind of dip and come back up and dip. So you're not this blatant, what we think of in our minds through, all kinds of stuff. But so the point I'm trying to get to is I realized at that point, my family, it wasn't about alcoholism, which my mother has passed, but before that, she was actually diagnosed as bipolar.
You,
So literally, both parents were bipolar.
I was gonna say it sounded like your dad was for sure.
Oh, absolutely. And so it wasn't this alcoholism, or that could have been a symptom of part of it. But and I have to say, if I brought it forward to this moment, out of the siblings, I am the only one that continues to take the medication, and I joke about it, and God bless them, but I have conversations with them, and I can kind of see they're a little off the rails. I know when they're not medicated, when they quit taking it. And it kind of breaks my heart because I don't think people understand. It's not a personality disorder, but um, they're just blind to how they come across to others. And I don't think they come to you till they're kind of at the last, whatever, something isn't working or family members have convinced them. And like in my profession, it doesn't work if they don't want to go. Um, but it is hard to kind of accept this diagnosis. I find myself still being a little bit defensive. And it's when to disclose, when not to disclose. But I have clients now that it's so hard. I'm not the physician, but it becomes very obvious to me there's probably a mood disorder. And what usually leads up to it is the first thing they'll tell me is, I've tried medication. I'm not interested." And I say, "Well, what happened?" Or, "What's your history with it?" And it's always, antidepressants didn't work for me. "Well, what happened?" "I got worse." How do you mean you got worse?" Some of them, it's they got more depressed, and some of them said it agitated them. They had insomnia, and they had intrusive thoughts, and they couldn't drop, that was perseverance. And I thought, well, that sounds like it could be kind of there's a misdiagnosis there. It, and I wish that I could really encourage them to try again, because it's, to me, the way I understand it is, if there really is a mood dysregulation, like more towards the bipolar, you really need that stabilization versus just hitting on that particular dopamine receptor. Because I know for me, they had given me many prior to you, they'd given me many different antidepressants, and there's no way. It wound me out. My sleep was worse. And I think it might have been you I heard from that said, "Well, this is exactly what leads me to a different kind of diagnosis, or different prescription to better address what's going on." And the journey there is it's hard to tell people that it is, quote, a cocktail, and some people can't handle it. "I'm done taking meds." But often, it can be 3 or 4 meds that you take. But the way you do it's wonderful, because it's kind of one at a time and very low dose, versus, I think, in the field of psychiatry, it was just boom, here's the dose. And so people go, "Oh, wow, I'm so out of it. There's no way I can take it." Instead of what you do, which I don't know if the right term is, like, titrate it up a little bit, kind of see. And the other thing, it's like a little ad for you here. You are so present and respond so immediately. And that's getting rarer and rarer. And it's so appreciated. I know I've referred a couple clients to you, and the feedback from them is just amazing. I mean, we don't talk, and we keep the confidentiality, but that's always a comment. Dr. Corona is like, "Wow, I didn't have to wait, he got back to me." And I'm not talking about making appointments, I'm talking about like medications and following up. And I remember being very pleasantly surprised how present you would be. Like, you'd call every few days, "How's it going?" And checking in. And it's good. It was difficult to kind of tweak and get that just right at the beginning. And every once in a while we try something different, and I kind of know quickly what's going on. And that's something else that a lot of the psychiatrists, MDs, I wish would say, and that pretty quickly, is my point. Because I've had so many clients say, "Oh, no, I'm feeling real, suicidal, and I'm on this antidepressant. But, he told me to keep taking it for 4 weeks, and that I'll get the real results." And I just want to scream. You know, I,
It's
I feel like I'm putting my license on the line. I say, "Please call your doctor. Please leave a message." I've even had where I flat out said, you can't take that anymore. You know, in the interest of, you know, God, nobody should be suffering that badly. Um,
it's a myth. There's kind of a myth in this field is that it takes things 4 to 6 to 8 weeks to work, and people are suffering the whole time. And the thing about bipolar disorder is it can be very subtle, and we're going to talk more about that in a moment. But um, sometimes the regular typical antidepressants, whether it's an SSRI or even the SNRI, like my favorite one for Steep or Effexor, they make it worse. They can make people worse. And you've probably taken that or Zoloft or Lexapro or something like that. And it's not typically the right one because normally the main chemical involved is dopamine, and this is why I think I also you're on Wellbutrin, you're on a low dose of Wellbutrin,
Mhm.
which is typically the best antidepressant with bipolar if you can tolerate it. It doesn't take a lot of it. Like in your case, it's low dose.
Mhm.
Lamictal is the safest antidepressants with bipolar because it's well tolerated and it's effective. Seroquel is amazing. Um,
Mhm.
you were mentioning, yeah, and this, the other thing, like in this field, in any field of medicine, is customer service. It's just dead. I think it used to be better in the old days. From the very beginning of my practice, I've always made my policy. I call everyone back same day, every day. I return every email same day, which is catches people off guard, but they don't expect that. And what I do with every new patient too is I say no matter what I do, I say call me in a week, not an appointment, not no charge. Call me in a week and let me know how the first week goes because I can tell by then if I'm on the right track or not. I can tell that quickly within even the first half week to week. If I've chosen the wrong medication, I can tell. And that gives me a chance to stop it and try something else before the next visit, or to say, okay, well, the dose is too low. Let's go a little bit higher now. And now
Mhm.
in your case, have you? I'm trying to remember. Have you ever had any kind of a manic episode or hypomania?
It- 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 That's a tough one. I could get by with very little sleep. And I used to work, I actually worked weekends, and I remember I could stay up all night and come back and do another 12-hour shift. And of all things, I was working in a hospital pharmacy, but I did not abuse the drugs at all. That wasn't my thing. Um, so I would say the insomnia more so than anything. But I will this is funny because I was just talking to someone this morning. It was another therapist, the subtleties of like the lamotrigine. And I was explaining that, having just gone through menopause, suddenly I was clear-brained. I wasn't foggy at all. And recall of names and that was right there. And the other piece that was so huge for me, and to me, I don't know why this matches bipolar in my mind, is that perseverating thinking, that whines and whines. Whereas if I had a bad breakup, or if somebody had offended me, or some horrible situation happened, or something I didn't like, I could perseverate. It would not leave me for days. With the right chemicals for my brain, particularly, well, yeah, they both kind of work together, but particularly with the lamictal, that no longer happened. It was a more appropriate response to the situation. I would get angry when you get angry. I'd be sad if you're supposed, appropriate response, but it didn't stay for weeks, or I'd wake up in the middle of the night and be thinking about it, or wake up in the morning being all depressed or anxious about it. That was gone. And so it was subtle. So in the long run, it's like the things that went away are the things that I don't want back again, thank you. You know, so there's these kind of subtleties. I think people don't realize it when it's hard to assess yourself when you're the one doing the meds,
Right.
but but it happens. I think you've mentioned like a medicine journal. I've done that, but then I kind of quit doing it when I see the pattern, so I know it's like, okay, this is what I'm going to tell them, that kind of thing. But yeah, there's some great subtle things that change. And I remember a real poignant conversation with you. I was still working, and my administrator, full time, and my administrator, this was teaching job, something had happened, and it was just so offensive to me, being criticized or accused of something I didn't do. It was real egregious, and I was very angry. And I remember talking to you and saying, I think I need more meds or something because I'm really pissed off. And and you said, never forget. You're like, well, tell me what's going on. And I shared some of it, and it was hard not to laugh. I don't remember if you laughed or not, but you said, "Well, I'd be really pissed off too." And he said, "You got to understand, Karen, that's exactly, we want you to feel all your emotions. This is not taking the emotions away from you, but and you go on. It's not like, it's appropriate. You need those emotions because it's an appropriate response. It's, what we do in this world." And I really enjoyed that. And I will say, I'm going to put this in here real quick. Years ago, many years doing Al-Anon, and I remember my co-sponsor at the time, we were like in adult children of alcoholics or whatever. And I remember one morning she called me up. She said, "Karen, I figured it out. I figured it all out." I go, "What did you figure out?" She goes, "Normal people." She said, they wake up and they have all these emotions and they just go on with their day. And I thought, okay, I get it. So the to her it was like you have all these emotions and people do, but it's kind of at a calm, yeah, and you go on with your day. Because everybody normally has all these internal dialogues going on. Oh, there's so and so. So you look like, okay, I'll say hello to so and so, and I'm going to ask them. I mean, we have this constant dialogue going, but that dialogue is not um, wrecking our day or ruining relationships or causing incredible grief or regret. So those are the kind of changes that are wonderful. It's like you kind of don't realize how much you were affected by the chemicals until you're kind of on the other side of it. Um, and I think you've mentioned it's like you want to bring your clients back to the point, like when did they feel joy in their life or feel very fully like themselves, like, all pistons are firing kind of thing. And
And that's what
so
we should be doing. It's recreating a normality, and it's preventing. It takes someone who's like this going to more like bumps in the road. Like in other words, and one of the side effect issues we have always look for we call apathy is lack of emotion. So that's more common with SSRIs. We'll see like people say, yeah, this happened and I had just no emotion about it, and I should have emotion about that. So that's not a good thing to have. When I don't like to make people apathetic, and side effects in my view are not acceptable. But like I said, and in your case, I don't, it doesn't sound like you've had a manic episode. It might be more of a bipolar too, like a hypomania. With hypomania, sometimes your thinking can be rapid. People with bipolar too. I call it a gift. Having bipolar is a gift, and people are like, gift? How is that a gift? Well, it's a gift because bipolar people are smarter than the average person. They're more creative. Um, and so it's a gift in that sense because we can a lot of us can get more done and all that. But and the bad part is obviously before it's treated properly, and with that can cause a lot of chaos. Yeah, but in your case, and the one hint to that, what you just said a moment ago about the fact that some people say I can get about 4 hours sleep and I'm good to go. I have good energy. It doesn't. Now, if someone says I get 4 hours sleep and I feel like crap the whole day, I feel so tired. That's probably not hypomania. That's probably more depression. But the majority of bipolar is depression. It's not mania or hypomania. It's depression.
okay,
And
that's
and I think with your case, the Seroquel helps by we call it dopamine antagonist. It helps to shut down dopamine, so gives your mind a rest so you can sleep. Wellbutrin turns on dopamine in the daytime, so that way, without the Wellbutrin, you'd probably be tired and not as motivated. The lamotrigine, is just like kind of keeps things at a steady, keeps you from getting into the deep depression stages. So that's why the combination you're on is a really good combo. We call it
you know
Corona cocktail. So.
that's so interesting. I'm always learning something new. What you said, identifying, because I definitely, fortunate or unfortunate, I think I meet all the criteria because I remember even as a child, they tested me, my IQ scores, and it was high. I remember, in the 50s growing up, I was not the kid who fell asleep. I was always, a lot of insomnia throughout my life, but it was kind of excitement a little bit. Like I had a radio and I'd turn on music next to my bed, and there was a TV, though, black and white, and I'd turn it on with no sound. And I'd watch, this is before videos. So that was kind of um, that's funny you say creative, because even now, I'm in my early 70s and I'm like, oh, I'm going to play the guitar and I have a piano. But it's fun, I get to go tinker around on it, and it doesn't feel like mania in any sense at all. It's just, I have a huge curiosity and I love to learn things, and I don't know how much life I have left, but I hope it's enough for me to continue to do these fun things I want to do. And um, it is very, very different. It's
Wish your yeah, wish your siblings were a little more compliant, but um, you can't force someone to be treated, and like I think you said before, a lot of problem is that people don't recognize they have a problem. They think it's just normal. Uh,
Mhm.
and they just think it's, oh, this is just the way I am. I don't want to change who I am. And so a lot of people get caught up in that. There's a lot of this anti-medication mentality. I don't want to be on meds, or I don't want to be on more than one thing. Well, that's not how it works in the real world. You can choose to not be treated, but your life is not going to be as quality as it would be if you treat it. And treating it is not scary, and the medications can be to the point where we can get the right combo together without significant side effects. But unfortunately, like again, so many people they won't do it, and they could have a higher quality of life, but they choose not to. And
Yeah.
you have to also say there's a lot of most doctors out there don't really know how to do it very well, and so people get frustrated by seeing their doctor, the family doctor, and even sometimes psychiatrists. And a lot of doctors aren't just really that great with medications. There's an art to it. There's a science. There's also an art to it, and you have to understand the subtleties and how to adjust the doses correctly, and how to and that's something that I'm hoping to teach. I'm finishing two books right now. I've written years ago. I'm editing them right now. I have two books for doctors. So my intention in the future is to teach. So I'd like to do that with these books. So, but that's after this TV show is one thing that's been work have this last year, but that's my next thing I really want to do also is to teach, because I want to spread the word. I think primary care doctors need to step it up, because we have enough training to be able to learn this and do this more. But a lot of the primary doctors don't do it. They don't feel comfortable with it. And psychiatrists, there's not as many. They're not as available. They're expensive, and
Yeah.
sometimes they're not the best communicators. They're not the best listeners. But you have to be in this field of medicine. You have to be a good listener. You have to let people tell their stories. If you don't listen, doctors are really good at talking, but we're not really as good at listening. And the,
Mhm.
the key of communication is listening, not talking. So if my I say this in my books. So if you listen long enough, people will tell you what's wrong. The patients will tell you what's wrong if you listen long enough. They'll tell you. Just let them come in, shut up for a while, and let them talk. Let them tell their whole history. Like when I first see a patient, I get their whole history, all the details, every little part I want to hear. And then when I have them follow up with me, I check and I go, well, tell me about this, tell me about that. Is this better? Is that better? That's how I know how to adjust things, what to put in when, and so yeah. So, but
Well,
you've been on the same combo like for a long time now.
um, so back to the beginning, if I haven't said it already, I can't emphasize enough. You're not a quack, you're a genius. You're on to something. This is a protocol, which is, I think, the title of your latest book I read. Um, and when you were talking about the resistant to medication, I'm going to go back on some clients and siblings. particularly bipolar, they'll come back and say, well, I didn't like it. I didn't have the same energy. And that's that lack of awareness that, well, that same energy is not fun to be with or around. And you see that as yourself when it's really, it's anyway. So that's one of the prime reasons they'll go off, particularly the bipolar medications, which is very frustrating. No access to my energy. I don't feel like myself. And whereas I'm thinking, and that's good because now we can, take it down a notch and be, or more focused or whatever it is when it's working. So basically, when it's working, they don't see it as working, which is unfortunate. And then the other, which is a whole nother subject that I don't really have experience with. Well, I do, but not personally, is schizophrenic. And I've heard it explained from a schizophrenic individual that they go off their meds because the world makes sense to them when they're off their meds. And when they're on meds, it's like so different for that's some type of resistance at some point. I'm not an expert on it at all. I don't know if it's the beginning or, but I thought that's really remarkable because I'm always fascinated by those two because, like I mentioned earlier, they're treatable.
Well,
And you can full remission from those. So,
fully treatable, but the biggest issue with schizophrenia is definitely compliance. And you're right, because they don't want to, they like the mania. Or that it's not even a mania, that it's psychotic thinking. They're, where they're fearing the FBI is after me. They're tapping my phone. They're monitoring my movements. The mafia is after me. Whatever. It's But see, they call that their normal, and they say I don't want to, or I don't want to be dumbed down. I want to feel my feelings. Well, the problem is they're not reality, and so their lack of reality is their reality, and so compliance is a huge issue with schizophrenia. Bipolar is, I call it schizophrenia light. It's not the same level; it's a level below that. Where but schizophrenics are kind of always, pretty much always irrational, and so that's hearing voices and seeing things that aren't there, and so now that's why they have now these like once a month injectable antipsychotics for a lot of schizophrenics. And, because a lot of them are homeless. The ones that don't have a support system, they're homeless, they're on drugs, um, and they get in trouble and they commit crimes and they get in the court system. And then so sometimes they're court ordered to actually, take an injectable, or they go back to jail again. But again, I know many schizophrenic patients, they do really, really well if they just stick with the medication. That you can't go off of them. So many people say, well, I'm better now, so I can go off of them and cure. No, it
mhm.
doesn't. That's not how it works in this field of medicine. We don't cure in a sense of that, oh, okay, take this antibiotic and your infection is going to go away. We fix it, but you have to maintain the medication, because the medications are continuing the normality of the flow of the neurochemicals. If you take the medications away, the neurochemicals go out of whack again. And then
Mhm.
the biggest reason is genetics, and you have it on both sides of both parents, and then you look at your probably grandparents and all that. It probably keeps going. It gets worse after menopause, and it gets worse when you're with trauma. So and so the reasons why it happens, people have no control over. The one thing you can control is treating it, and going to a doctor who knows what they're doing and treating it. So. And I'm hoping that this reaches people. It's a TV show, because I'm also available. I have a lot of people out of state. I see, I keep in touch with, and either people who move, but even new patients, and can contact me to get help too. So
Yeah, that's wonderful. I also, uh, you made me think of one other thing. They often people will resist it because they'll say, I don't want to be on meds my whole life. But, you know,
hear it all the time.
Yeah, the alternative is just yeah, I the alternative is just not a good one.
Not. And, so that's why it's a lot of my time is spent convincing people. And that's just saying, give me, the patient I just saw a little bit ago, give me a week. I said, just, because I saw her 3 months ago and she didn't take it, what I gave her. And she's now coming back for appointment. And she said, I didn't do it, because I was working on my breathing and my exercise. Like, that's great. You keep doing those things. Whatever helps you, whether it's meditation, yoga, exercise, all those things, or counseling, meditate, all those things help. There's no question. But when you have a chemical problem that's fixable, medication is not a failure. It doesn't mean you're not doing something. It's just a recognition that there's a deeper issue that you can't help. And medications are not addictive. And like, well, how are they not addictive? Because I can't, if I don't stop them, they don't work. Well, I said that's not addiction. That just means
Right.
diabetics not addicted to their insulin, but then they stop the insulin and then they see the thing going downhill pretty quickly. Um, or a thyroid patient taking a thyroid supplement and you just stop taking it, and they feel terrible. Not addiction. It's just, well, why are you stopping it? Well, because I was feeling normal. Okay. That makes sense. You feel normal. Maybe you were feeling normal because you were taking this. Maybe because you thought about that. So
Yeah, it's actually making your body function at a better level. Um, yeah, it's there's so much. Um, yeah, that one other thing I was going to say that like being mental health professional also I hate to say it. I mean, I'm not a diagnostician, but I have a pretty good idea of what's going on.
we're very
And I find myself talking about organic causes versus other causes. And so I will instruct about genetics and you know, it's hard because they often still don't get it. But my point is bipolar or severely depressed, any of that actually is treatable. You can do talk therapy and like you mentioned the client, the breathing and all that, but I know when felt anxiety before, and if somebody told me to just breathe and did breathing exercises, I probably wouldn't see them again because it felt like way beyond that. So I wish that they would be a little more open.
yeah.
It's kind of tough. The problem is if it was just talk therapy, it's going to take years. If they did the medication and talk therapy, we could be talking a few months, and so that's a better option all the way around for the client or
I
patient.
talked to yesterday. He's been off work for a year. The work says you got to come back or you're going to be fired because a year is our limit. And the whole year he saw this quote unquote holistic doctor who doesn't believe in medications. And so he's taking these herbs and supplements. You talk to the breathing technique, which I do with my clients too. We talk about breathing. Hey, maybe taking a meditation class or yoga, learning how to relax your body. And so he said he did some talk therapy, and he said a little bit it helped here and there. But he's still a year later. He said, I'm just not ready. My anxiety is just way too high. I'm still depressed. And so now I'm kind of trying to get another month off work, so give me some time to get him better. And he said that they told me, okay, we'll give you a very short time, but you have to go to a doctor who moves quickly. So now I'm the pressure's on because I need to get him back to work, or else he'll lose his job that he loves. But this whole year has basically been wasted with lack of treatment that he could have gotten. And so that's an example of the and that and then, again, I don't mean to down other doctors, and I don't know who this doctor is, and maybe that stuff works for certain people, and it probably does. Because there's a lot of over the counter stuff that you can get that can help a little bit, but not it doesn't have the power of the medications I work with. No way, not even close. So yeah, but the good thing with him is I think I can get him back to work within the next month, hopefully. and
Oh,
keep
good.
keep his job. So, and you're still in practice too, right? You still see patients?
Yeah, yeah, and it's interesting when you're talking, it also occurred to me that I don't know how much time we have, but it's starting to really hit home with me being a practitioner now that how much a part of depression anxiety is. Previously I was like, no, they're completely separate things. But I think there's a certain level of anxiety that we all feel. But then when it's, kind of takes over, and I did speak to one of my clients this morning, a new one, and the anxiety was so evident, but she was prescribed anti-anxiety medication because she, quote, can't take antidepressants, and it's really hard to be me and sit there and I can't go there because I'm not the MD. And so I guess there is a question in this. My apologies. So how much do you see anxiety with depression? I mean, it's often like just the flip side of it in my mind, because like real anxiety, I like to tell clients, I preface it with anxiety works for us. It gives us that, flight response. We're in a dangerous situation. So it's kind of our friend in some ways, but at what point is it beyond us? And I'm starting to really see it as it goes into depression. It's this fear and kind of hopelessness over situations. And so I'm not sure getting knocked out on anyway, I don't know. That's beyond me. That's not in my realm. But
You got it just right.
when you have somebody who's super anxiety like that, I don't know.
You got it just right. It's probably the number one thing I see in my practice is anxiety disorders. Number two is depression, but they travel together. It's actually more unusual to have one without the other. And there's you're saying it's correct. There's the normal anxiety, the fight or flight response that protects us. In other words, for example, if we're driving and then we see a car slowing down quickly and then prevent an accident, you slam on the brakes and your heart starts to race and because that's you responded quickly. That's the fight or flight response. That's comes back from the caveman days when they were so
Mhm.
but what's abnormal anxiety and when it goes beyond the normal, when it starts to affect people's lives negatively. It's because some people, you're right, they're driven, they're actually, anxiety helps them a little bit. It keeps them, it drives them, and that's if that's in check and they're not having any negative repercussions, that's fine. If that's what they is great. But when you see the anxiety and then that turns into depression and they fall down and then eventually they pull back up and when they start to see that swinging from anxiety to depression, that's when it should get treated. The other thing is, when I hear anti-anxiety medications, they're not that effective. They're either Band-Aids like Xanax or Ativan or Klonopin or whatever, or they're Boost Bar, which is not that effective. And the number one treatment for anxiety disorders are antidepressants. So antidepressants actually really treat both. We call off-label use. So off-label use means using a medication for a purpose that it wasn't originally indicated for. And so that's why the number one thing I use for anxiety disorders is antidepressants. Especially my number one is Prestige, Effexor, and sometimes Cymbalta. Less commonly SSRIs, Topamax, gabapentin. So there's other, medications that we really can focus in on anxiety and depression, but they're totally treatable. And then, but like I said before, we got to move quickly. We can't tell people, oh well, it's going to take 4 to 8 weeks to work. That's not true. Never been true in this field of medicine. It's a myth. The textbooks still say it, and the problem is when something takes so long and you move really slowly, people lose hope, and then they may not come back to see you. When I tell them, like, forget about that, I'm going to get you better within a week or two. It's not going to take a month. It'll take 1 to 2 weeks to get you feeling better. And I'm usually able to get people significantly better with between the first and second visit. Within 2 to 3 visits, I'm able to get people to remission, which is the goal of treatment. My average patient's probably on two medications, probably two to three medications, because that's the combination is really what works for people. Some people
Mhm.
are on one and it's enough. That's some people. It's very simple. But the thing is, for me, I want people better quickly. Not, I want to wait around and just let people suffer needlessly.
Yeah, interesting. And I know in your book it was fascinating to read what got you there too. The not being able to treat, address everything in a fibromyalgia uh, patient, and so important the mood aspect to that, and the pain set, receptors. We could go on and on.
Right, I run a little bit. Yeah, but my newest book, The Corona Protocol, I wrote it because it's different than my other books that I wrote. It's really focusing on storytelling.
Mhm.
I start the book. The first chapter is on anxiety disorders for a reason. I start there because that's the number one thing I see. Chapter two is depression. Chapter three is bipolar, because these are the top three things I see. And so, what my book does is I talk about the subject, and try to be brief about it, because if I tell people, if you want to read more detail, get my first three books. But I focus really more, it's mostly on the storytelling. And then I do talk about medication in the book. I try to simplify it. I don't want to bore people with the medication, but what I do reveal in the book is my decision making is why I choose certain medications for certain patients. and and so I want people to not only just read really interesting stories, but I want people to come away with the fact that there's actually effective treatments for it. It's not just about, there's actually safe, effective treatments out there that are not addictive, that get
Mhm.
people feeling like themselves again. And feeling like themselves again is remission. Some people say that to me. Some people say to me, "I've never felt as good. I think I've been suffering since I was a kid." And because
Mhm.
like with your parents, I knew your mom before she passed. She was a patient of mine,
Yeah.
and she was a bit difficult.
Mhm. Mhm.
I remember she was not
Yeah.
she was not the easiest person, but but yeah, but it's like I said, we can't help it. If it runs in our family, it is what it is. It's we either try to ignore it, like a lot of people do, and just try to brush it off, or we just say, look, why not feel better? And why not? There's no reason to not treat it. You know. Because if people are afraid of something like side effects, okay, well, we can find something that doesn't give you side effects. If you have side effects, you can stop it. It's not that big a deal. But so
Well, I have to say my takeaway from this, um, I hope people listen because a lot of information here from you, which is really good and important and, true and real. But I loved what you said about the bipolar too, that it's like a winner, you know. What is it, 20 years later, where I'm like, oh, I'm a winner.
it's a gift. It's a gift.
Yeah, it's like,
It really
yeah,
is.
the creativity and yeah, that's all. It's so true. Yeah.
A lot of the most successful people out there, a lot of the very wealthy business type people own companies, a lot of them are bipolar, and some of them can be hard to work for because they're so up and down, and they can rage, especially men.
Hmm.
Men are more likely to come out in anger, irritability, and anger. When men aren't feeling good, they get angry, and women get more emotional.
Yeah.
And it's not just that always this, because women get angry too, and men get emotional. It's not 100%, but that's how men present. And sometimes some of these high corporate people, they're hard to be around because they blow up at their employees. They're raging. People are afraid of them, and so and there's a lot of well-known movie stars.
Wow. Yeah.
Fortunately, Robin Williams is an example, and so
That's so true. I used to work designing for shows like opera companies, ballet companies, and you're right on the mark there. I would say the percentage of bipolar was just so huge. it explains, and it was always, well, because I'm a creative person. Well, bad behavior is bad behavior, it's not, anyway, yeah,
Yep.
yeah,
So
that's
thank you so much. Anything else you want to add, or before we stop?
okay. There was something, but I lost it. So maybe there'll be another time.
Anything else you'd like to add, or are we good?
Um, no, because there was something I thought of. I'm listening to you, and then of course some of my thoughts, I go, oh, I gotta ask him about this. So anyway,
I'm a phone call away.
yep.
Uh, but
And
you've been a pleasure. I wanted to have you on because you have a great story, and you just been a pleasure to work with over the years, and we've had a lot of fun, a lot of laughs, and I like that with patients to be able to, to be, like this, it's like with a lot of patients, it's like talking to an old friend.
right. Oh, I love it. Yeah, I enjoy our talks too. I thought of what it was. The flash pan anger, I just want to say that was so prevalent in my childhood, where I would just kind of run up and down the street and be outside climbing trees because there was so much that was part of the chaos. Suddenly somebody would blow, and then a few minutes later they act like it didn't happen. I thought, boy, that's pretty crazy.
Yeah.
So yeah, yeah,
Well, thank you, Karen. I really appreciate you coming on and sharing with us. And
yeah.
I know it's going to
And
help.
I can't recommend you high enough. I really wish that all of my clients would, you know, go to you and then we can talk.
Yeah, I do a lot of I have a lot of patients out of state, so I'm a phone call away. We can either set up a
Yeah,
Zoom or phone call. So people who can't come in my office, I can still help. I do it all the time. So,
yeah.
but it's been a pleasure, and thanks for coming on with me. I hope you enjoyed the show today. If you have issues with mental health, or if you know someone who needs help, I'm available. If you want to contact my office, my website is drpaulcoronamd.com. That's DR for doctor. And you can also learn more about me on my website. My phone number, if you want to contact my office directly, is 949-481-0118. If you want to learn more about my methods and what I do, my latest book, I recommend The Corona Protocol, a scientifically proven medical solution to stop addiction, bullying, homelessness, school shootings, and suicide, 30 years in the making. In this book, I tell 30 original short stories about people. And I also have my first 3 books, Healing the Mind and Body, the trilogy, available online. I look forward to you joining me again on the next episode of The Dr. Paul Show.